Together, we've lost an additional 34 people. I ask again, over and over, let's don't let these people, these great West Virginians, just go down as a number. These people need to be remembered and respected and in our prayers. The 5,022nd death, a 69-year-old female from Greenbrier County. The 5,023rd death, a 70-year-old male from Mineral County. The 5,024th death, a 67-year-old male from Harrison County. The 5,025th death, a 66-year-old male from Grant County. The 5,026th death, a 77-year-old female from Nicholas County. The 5,027th death, a 57-year-old male from Kanawha County. The 5,028th death, a 66-year-old female from Greenbrier County. The 5,029th death, a 74-year-old male from Jackson County. The 5,030th death, a 94-year-old male from Mingo County. The 5,031st death, a 78-year-old male from Marshall County. The 5,032nd death, a 61-year-old female from Barber County. The 5,033rd death is a 71-year-old male from Wetzel County. The 5,034th death, an 82-year-old female from Brooke County. The 5,035th death, an 88-year-old male from Jackson County. The 5,036th death, a 71-year-old female from Jefferson County. The 5,037th death, an 82-year-old male from Wood County. The 5,038th death, a 76-year-old male from Berkeley County. The 5,039th death, a 73-year-old male from Mingo County. The 5,040th death, a 72-year-old female from Raleigh County. The 5,041st death, a 71-year-old male from Logan County. The 5,042nd death, a 68-year-old female from Raleigh County. The 5,043rd death, a 44-year-old male from Upshur County. The 5,044th death, a 62-year-old male from Marion County. The 5,045th death, a 75-year-old male from Marshall County. The 5,046th death, an 87-year-old male from Wood County. The 5,047th death, an 89-year-old female from Raleigh County. The 5,048th death, a 52-year-old male from Wood County. The 5,049th death, a 75-year-old female from Taylor County. The 5,050th death, an 81-year-old male from Ohio County. The 5,051st death, a 66-year-old female from Jackson County. The 5,052nd death, a 70-year-old female from Wayne County. The 5,053rd death, a 74-year-old female from Berkeley County. The 5,054th death, a 50-year-old male from Kanawha County. And the 5,055th death in West Virginia is a 67-year-old male from Preston County. "92.2% of the deaths that we have here are people that are unvaccinated. You got a 9 out of 10 chance if you're unvaccinated. Active cases are 8,857 in West Virginia, 1,182 new positive cases. We have a daily positivity rate of 8.09 and a cumulative rate of 6.29. We have a little over 290,000 people that have recovered, got this and recovered. We have 593 that are hospitalized, 205 in the ICU units, and 124 that are on ventilators. We have three green counties and 25 red counties. We have 15 outbreaks in our schools in 13 counties, 349 folks. Well, I'll get to this in just a second, but you know, as a reminder again, I've told you over and over, if you get any symptoms whatsoever, you're 65 years of age, go get a test. The antibodies will save your life. I've said it 1,000 times. The antibodies will save your life if we can catch this early enough. If we don't, it's really bad stuff, really bad. I encourage you about wearing a mask if you're 65 and above and you've got any kind of pre-existing conditions and you're in a crowd of people indoors you don't know, you should be probably wearing a mask. All the booster shots, everyone is encouraged all across America now to get your booster shots. They're open to everybody 18 and above. I want to talk to you just 1 second about the booster shots. And we've done some really, really big stuff and some really important stuff. And it's hard to qualify and to say, or quantify, and say that this one's more important than the other one. But really and truly, if you do trust me, and you will just listen to me just a second, the booster shot is, you have already made a decision to get your vaccine. Your vaccine is wearing off. Now, the studies bounce back and forth in regard to the vaccine. But the booster shot is so important. Pfizer just came out and said that if you get your booster shot, it quantifies you 25-fold, 25 times basically, 25-fold as far as this Omicron virus or variant. There can't be anything in your life any more important than getting that booster shot. If you are out 6 months from when you got the first one, or if you're out 2 months on J&J from when you got your first dose with J&J, or you got your second dose from Pfizer and Moderna, and you're 6 months out on that, what in the world are you waiting for? Absolutely, without any question, you need to get this booster shot now. The bad weather's getting here. I just got a text this morning from our coronavirus czar, Dr. Marsh, and it was a long text. And he went into all kinds of detail that he knows ever so well. Basically, summarizing his text, it said just this: as soon as this cold weather gets here, we're going to get in real trouble. Summarizing his text, his belief, Dr. Marsh's belief, he said basically just this in the text: as soon as this cold weather gets here, our hospitals are going to get overrun and we're going to get in real trouble. Real trouble. You can be one or not be one. You got to get your booster shot. You got to get your booster shot. Okay, the numbers, I've been through this over and over. There's really no point in me going through the numbers again. As far as we've still got a lot of folks out in West Virginia that need to get vaccinated and need to get their booster shot. There's no question about that. We can tell you the numbers, and really and truly, the 65 and older or the 50 and older have really responded. The younger people, we're still trying to get them across the finish line. I worry about our younger people. Naturally, I would. But at the same time, I worry probably more because this virus attacks and really looks for the elderly. It looks for those that have some kind of chronic illnesses. Naturally, I'm super concerned about our young people, but I absolutely am telling you, our older people have responded well, but they've not responded well enough in regard to the booster. Our Do It for Baby Dogs senior center edition is rolling out now, and basically, there's some clarifications here. All West Virginians over the age of 50 are eligible. This is the target age range that we need to encourage people now, as well as our young people with Baby Dog 3 that we're out there. You only qualify if you get your booster dose after December the 7th. This program is meant to encourage people to get across the finish line and get their booster shot. If you got your booster, if you got your booster anywhere, not just the senior centers, you do qualify provided it's December the 7th and after. And this program will run right up to the end of the year. We have to get all the money out the door before December 31st, so don't wait. Go get your booster shot now, and we'll get you those dollars. And in addition to that, for the ones that are the most productive at the senior centers, we're going to award 4, I think is the correct number, 4, let me read this. Then the top senior centers in each of the state's 4, or top senior center in the state's 4 county aging provider regions, based on vaccination rate, will win $100,000 for that senior center. Now, come on. You can do a lot of good here. Lots and lots of good. Like I said, the baby dog, do it for baby dog 3, was targeting kids from the age 5 to 17. We're winding that down, but we're going to do, I think we've got 2 more, is that correct? One more school that we're going to, and we'll have a big party there to school and everything for the winners and everything. We've given away. There's 2 more schools in there. Yeah, there's 2 more schools that we've got to go to. 1 grand prize, and we'll do this. I think we do 1 Friday. Is that correct? We do 1 this Friday, and then the last one after that, and everything. But nevertheless, we continue to give away prizes to these educational savings funds, and that's great for kids and all kinds of other neat stuff and everything. And we're making progress. We're just not making the progress as fast as we want it to be. Young people, I call upon you again to go get vaccinated with the consent of your parents and everything. And all the information's up on our COVID hotline there. All the free testing still available. Walgreens and Fruits, we thank you over and over. We have 46 outbreaks in our long-term care facilities. We have none in our church communities. That's great. We have 38 inmates with COVID or the Delta variant right now, and 37 staff cases. I encourage you about getting the flu shot. That was another mention from Dr. Marsh. Dr. Marsh said we're going to end up with our hospitals overloaded. We're going to end up, as soon as the cold weather gets here, with flu cases that are in our hospitals, there's no question. But with this new variant here and with the Delta variant so contagious and everything, and the vaccination rates, especially the boosters, lower than they should be, we're going to end up with a run on our hospitals, and we're going to end up in trouble. Now, that's exactly the words of Dr. Marsh. Absolutely, exactly his words. And so with all in me, I encourage you to move now, and especially move on these boosters. From the standpoint of the rental assistance program, it's still there for you. Without any question, you should be taking advantage of this. If you're a renter or a landlord, just call us and we'll see if you can get qualified. Grand families, $150 voucher is running out December the 15th. You got a very, very short window to still qualify for that. We called it, "We are saving our wisdom, who are saving our future." Thanks for all the work you've done. And the last thing I have is the First Lady and myself. We did the Joyful Night thing. It's going to play tonight, Thursday, December the 9th at 7 p.m. I encourage you to tune into it and watch it and everything. I think you'll love it. And without any question in my mind, at least, the most sacred of all of our holidays is right here at us, Christmas. Christmas, the birth of Christ. Absolutely the most sacred of all, in my opinion. Maybe a tie, I guess, with Easter, but nevertheless, an incredible blessing that was bestowed on this earth. And so I encourage you to watch and everything. And there'll be some great performances here by Baileysville K through 8 school and the Cabell Midland Marching Band And the Parkersburg South high school band, is going to be here, are going to be, shown. And there's just lots and lots and lots of good stuff. The Mountaineer Challenge Academy is going to participate. There's just absolute great stuff. So Josh Perry, the senior pastor at Redemption Church in Huntington, is going to be with us. And so lots of good stuff tonight, and so tune in, watch that. But that's all I got right now.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd like to give you some data to reinforce what the governor just discussed and what drove the message that Dr. Marsh sent to Governor Justice. So our T value is now at 1.09 and continues to trend up. As we have told you before, that is a key indicator we watch that will then lead to additional challenges for us as a state. The hospital numbers updated, and we are now over 600 hospitalizations again. The other concerning issue related to that is the ICU numbers are up to 208, and the ventilator numbers up to 126. Those are significantly increased percentages of our total that we've had in the past. One of the numbers that we also watch are the daily admissions. And anytime we get above 60 daily admissions of COVID patients across our hospital systems, we know that's putting our hospitals in a detrimental position. And yesterday's number was 82. So we continue to see significantly challenging trends. And as the governor pointed out, with 3 holidays in succession, Thanksgiving, Christmas, and New Year's, and more cold weather and people moving inside, those who are unvaccinated and those over 50 in particular, but all over 18 who have not received a booster dose, are going to be challenged by this. In addition to that, another area that we see trending in an unfortunate direction is the number of flu cases that we are already starting to see in our primary care facilities. So in light of that, the governor has directed us at the Interagency Task Force the next week to run a tabletop exercise with all of the various agencies and organizations participating to look at the things that we will be able to do to help mitigate the challenges that we see coming in our hospital system. And the unfortunate circumstances are that those who are unvaccinated and those who don't get the booster dose are going to potentially prevent others from getting treatment and care because of the challenges that our hospitals will have. There's a lot of things we can do logistically, but as the governor pointed out before, one of the challenges that we have is staffing, and staffing is not an issue that's easy to fix with qualified individuals. As the governor also pointed out, the efforts with our senior centers, our interagency task force is working with senior services and all of our senior centers, and through some encouragement and direction from Dr. Amjad, we are going to also add flu shots to any of those events that we have as well, because we know those are critical to making sure that we are all as healthy as possible, particularly during what is going to be a challenging winter. Thank you.
Thank you, sir. Secretary Bill Crouch and Dr. Ayn Amjad are also joining us today and are available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior engagement, and he will rejoin us next week. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, everybody. I want to go to Dr. Amjad with this one. If you suspect you have COVID, should you go to your primary care physician first, or an urgent care? Should you go get tested before you go? What kind of process would you recommend in that where you have a legitimate fear that the hospitals may be overrun? Thank you.
Dr. Amjad, please.
Yes, Paul, that's a really good question. And I guess it depends on how sick you are or how sick you're feeling. But we'll take one scenario and say that the person thinks they've been exposed to COVID, is feeling maybe a little bit sick. Before they go and expose other people at a primary care clinic or urgent care, I would recommend that they go get tested and then call their primary care doctor with their concerns. Now, on the flip side, if you are having really, really severe symptoms and you think you're exposed, that might warrant you to maybe go seek more urgent care help, such as calling your doctor if they can do the test at their clinic, but you need to be prepared to definitely wear a mask and not expose other individuals. But getting tested is important, notifying your primary care provider if you can, and then monitoring your symptoms is very important. And then if you're going to go out around other people in the clinic, to definitely wear a mask in case you are positive later. Thanks.
All right, thank you, Paul. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. Just was wondering if you all have had any reports or detections of the Omicron variant in West Virginia, and whether you're actively monitoring for that. Thank you.
Evan, I'm sure we're actively monitoring it, but Dr. Amjad, or General Hoyer, you guys answer that, please.
Yes, Governor. We are monitoring for that. With sequencing and test results, we have not had any cases in West Virginia to date, but we continue to monitor any samples that do come in, but none has showed up in West Virginia as of today.
All right, thanks, Evan. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if there had been any consideration of another round of the Save Our Cares program, the money to help hospitals with staffing concerns, given the anticipated continued shortages we were just discussing. Thank you.
Charles, I can answer that one real quick. We absolutely stand on standby to do whatever we got to do, and that's the constant topic of discussion and everything, because we've got to maintain the strength of our hospitals, and so we're watching it and we're on top of that, and that's a constant issue that's on the table, and it's going to stay on the table till we get through this.
Thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, Governor, cabinet members, and fellow reporters and staffers. Thanksgiving Day, I believe we had 4,500 active cases in West Virginia. Today, we are just shy of 9,000. That is a doubling of the active cases in just 2 weeks. We continue to get 1,100, 1,200 new cases per day. The booster vaccination remains extremely low. Only 30% of those people age 18 plus who are eligible, meaning they had the first and second shot, have gotten the booster. That's not even counting the people who haven't even had the first and second shot, 18 plus. I framed this question with all of those facts and figures there, wondering, given the concern about hospitals being overrun, is there any discussions going on, and this is probably for General Hoyer, with Thomas Health System about reactivating St. Francis Hospital as a surge facility in the state if we're anticipating this much of an increase?
General, please.
Yes, sir, Governor. So, Mark, as I mentioned, the governor's directed us to do a tabletop exercise next week, and that will be one of the areas of consideration. But again, our most significant challenge is not bed availability space. It's the availability of staffing to manage care. We right now have some hospitals that do have beds closed down because of availability of staff. So, and as we've seen before in the first two surges, the unfortunate circumstance is this is a national issue. So we are competing nationally for staffing. So we'll look at a whole variety of things at the governor's direction to best serve the people of West Virginia.
Explain to all of our viewers what a tabletop exercise is. Yes,
sir, Governor. So the tabletop exercise, apologize, tends to be a military term for an exercise that where we walk through in a controlled environment with a facilitator, a series of inputs related to a scenario that in this case around hospital capacity and increases. Will cover everything from availability of staffing and beds to availability of oxygen to the throughput of oxygen within hospitals that may be full of patients needing oxygen. So a fairly significant effort to walk through scenarios and attempt to develop pre-planned plans and actions to better protect and serve the people.
All right, thank you, Mark. Governor, I'll turn it back to you.
Oh gosh, I didn't expect you to come back that soon, but all I can say is just this. You know, if you had gotten Dr. Marsh's text this morning, and here's a guy that we put as the coronavirus czar. You just heard from a great general that we have here in our state of West Virginia we've had a long time. You've just heard from Dr. Amjad, who's doing an incredible job. And Secretary Crouch, the same thing. You hear it from me over and over. We try every recommendation that could come down the pike. You know, without any question, across this nation, all states are in the same boat. None of us have a playbook. That's all there is to it. You know, a lot of people wonder, well, what happened with West Virginia? Well, what happened with West Virginia is we jumped out in front, did we not? We absolutely didn't put the vaccines on a warehouse shelf and try to develop a program for a month and a half. We started putting shots in arms. Now, when we did that, if you're fair, you've got to say we saved a pile of lives. Did we not? Did we not? We saved a bunch of lives. And that's exactly what we should have done. And we should be really proud of that. Really proud of that. And then you say, well, what's going on now? Well, if you want me to be brutally honest, it's just this. West Virginia is a very conservative state. And in a lot of situations, people can get afraid. And people are somewhat leery of the federal government. And, you know, in my book, you know, you probably should be. But with all of that, we've always known that there is a significant percentage of our people out there that are really unsure or dead set against taking the vaccine. Now, when all of a sudden people all around are threatening them, like our federal government did and said, if you don't get the vaccine, your employer is going to let you go. Basically, when they start threatening them, they just made them more difficult for us to get them across the finish line as far as the vaccine. So at the end of the day, we've always known West Virginians are free and stubborn a little bit and a little bit conservative for sure. With all of that, what did we do? And the mystery to some people is, well, what happened to West Virginia? They did so good. Well, what we should be saying is, yay, West Virginia, we saved a bunch of people's life. That's all there is to it. We got shots out instead of putting them on a shelf. We put them in somebody's arm, and we saved a bunch of lives. Now, we've all known exactly that we're a strong-thinking, conservative state. And we all know where we're located. We don't have an ocean all the way around us or a big Great Lake all the way around us. We absolutely have people, 2/3 of the population of this country, all around us. And we also know that we're elderly, and we also know that absolutely we got a lot of chronic illnesses in West Virginia. So we are the target. We're the target for this thing. Absolutely, absolutely, this thing is targeting West Virginia. Think about it. We're old, we're sickly in lots of different ways, and we're close. We're close to people that can bring it to us. So what do? We got out fast. We got people vaccinated. We saved a bunch of lives, but we've known all along that we were going to reach a point in time where people would be very reluctant to get their vaccine. The federal government made it a lot worse. These mandates make it a lot worse. I don't believe in that. I really don't believe in that at all. What I want to happen is us go on as best we possibly can to live our lives as normal as we can possibly do. But with that, I absolutely believe in all my heart that the only thing we have to combat this thing today is be vaccinated. And the last thing I'll say is just this. If you're vaccinated and you don't get this booster shot, it is a mistake like you can't imagine. An absolute incredible mistake. So please, please, if I have ever asked you from the very depths of my heart, please take time to go get this booster shot right now. It is so important. If you're 50 and above, you've done really good about getting vaccinated, but absolutely you've got to get this booster shot. So with all that, I'll leave you, and I'd say just this, last night, the good Lord brought into this world, our third grandchild, our second granddaughter, but she was born Emmy Ruth Justice, and she was, Jay and Catherine. Jay's our son, and Catherine, our daughter-in-law. They live in Roanoke, and the baby was born about 1 o'clock this morning. So anyone that knew that we were close and everything, thank you for your prayers, and she's just a beautiful little girl. So we're really blessed to have her. So anyway, that's all I got today. Thank y'all again.